Professional basketball is seeking a new home to return to training in a professional, safe environment toward playing out the remainder of the 2019-2020 season. Every precaution must be taken to ensure the safety of players, trainers, owners, media, and their families. Enhanced cleaning of surfaces and social distancing are a given. Stadiums and courts provide recirculated air, but what about in areas where close proximity cannot be avoided? The greatest threat is from airborne particles that can linger in the air for hours. Watch this.
One of the top questions we see from you, how does the coronavirus spread? Scientists are revealing new answers every day. The main method is when an infected person coughs or sneezes, sending out droplets into the air. Early research showed those droplets could travel up to 6 feet, but a new group of researchers thinks it could be even further. Take a look at this. This is a model they created that shows what happens when you cough in a place like a grocery store. Look at that. Look at how the cloud spreads. The researchers say an infected person could cough and walk away, but they leave behind small particles carrying the virus, which can end up infecting others. And those particles can live in the air for a while. Researchers at the National Institutes of Health, the CDC, UCLA, and Princeton found the virus can live in the air for about 3 hours.
On May 27th, the CDC updated their interim guidance for businesses and employers responding to coronavirus disease. As a part of their recommendation to improve ventilation, they suggest ultraviolet germicidal irradiation, a method of disinfection that uses short wavelength ultraviolet light, UVC, to help inactivate the virus. The CDC refers to ASHRAE, the American Society of Heating, Refrigeration, and Air Conditioning Engineers, position document on airborne infectious diseases. ASHRAE recommends installing UVC fixtures on or near the ceiling to irradiate upper room air, disinfecting the air directly within the occupant's breathing zone. The fixtures are recommended when ventilation rates are low and are typically mounted at least 7 feet above the floor. UVGI, in the form of UVC light, has been recommended or used for the isolation of disease and biodefense systems for buildings by the United States Army, the CDC, and the Federal Emergency Management Agency, FEMA. The VidaShield UV24 system uses UVC light and filtration to draw in and treat environmental air. UVC has been shown to kill SARS-CoV-2, the virus that causes COVID-19.
Why not consider the air? Doctors wear masks during surgery. Dental hygienists wear them during routine procedures. There is risk of spreading C. diff from simply flushing a toilet. And well-child visits account for 700,000 new cases of the flu each year, costing $500 million. UV has been used as a disinfection tool for decades in healthcare. But the challenge with UVC technology has always been the method of delivery. It can't be used in occupied spaces and is only effective in areas that are direct line of sight. Until now. That is exactly what makes VidaShield different. Operating 24/7, 365 in occupied spaces, VidaShield is a fast, continuous UVC air purification system that reduces the levels of bacteria and fungi in treated air and reduces the settling of viable bacteria and fungi on surfaces. Healthcare staff have reported improved indoor air quality and reduced odors. The patented VidaShield is an active system that draws microorganisms to a UV light. There are 2 vents on the face of the fixture. Behind one is an array of fans which draws air through a MERV 6 filter, which removes larger particulates of dust. Air is pulled through the filter into the UV chamber mounted on the back of the fixture at approximately 50 cubic feet per minute. It can treat a volume of air equivalent to a 10 by 10 by 8 foot room, 4 times per hour. The air moves through a set of safety baffles which prevent the UV light from escaping the chamber. Once in the chamber, a high-intensity UV lamp operates at the peak wavelength of 253.7 nanometers. The air is then pushed through an opposing grill at a 30-degree angle to promote circulation of the treated air throughout the room. Once VidaShield is installed, it requires no engineering controls to operate and minimal maintenance, which helps keep operational costs low. VidaShield is designed for use in hospitals, long-term care facilities, nursing homes, schools, commercial office buildings, and any other location where cleaner environmental air is desired. The energy-efficient VidaShield is available in 3 styles.
The UV24 units irradiate the air directly within the occupant's breathing zone at a rate of 50 cubic feet per minute. Each unit provides 99.99% zonal protection for a 10 foot by 10 foot by 8 foot room every 15 minutes. The units are concurrently treating a much larger area, providing 80% zonal protection to a 25 foot by 25 foot by 8 foot room. 3 cycles provides 93% zonal protection. The size of this typical restaurant floor plan is 1,084 square feet. The configuration accommodates 82 patrons. The red squares represent open tables. The blue circles illustrate the 6-foot social distancing guidance recommended by the National Restaurant Association. Adjacent tables within the 6-foot radius need to be closed to conform with the NRA guidance. Of the 82 seat capacity, 34 must be closed. This represents 41% of the available seating. A restaurant of this size and configuration will require 4 units to achieve 93% zonal protection every 43 minutes. Make sure that once your facilities reopen, they remain open with VidaShield.